let's turn to a headline that is creating some backlash and confusion as the Department of Education left nursing and other professions off a list of, quote, professional degrees in a proposed rule over loans. And this move could affect how students finance their education in the future. There are hundreds of thousands of nurses and soon-to-be nurses impacted by this, as annual loans for new borrowers capped at $20,500 for graduate students, $50,000 for professional students, and a lot of outrage and backlash over this. Let's bring in right now the president of the American Nurses Association, Dr. Jennifer Mensik Kennedy. I appreciate your time here on Live Now from Fox, and rightly so, there's a lot of conversations happening about this. How does this directly impact nurses?
No, thank you for bringing up this topic. It is so important. And I'm really hoping this is just a miscommunication or a misstep with the Department of Education. But we're hearing from many nurses and many individuals who want to go into nursing, many individuals who want to become nurse faculty, and advanced practice registered nurses who are wondering if they should continue with this education. And so with these caps, the way they are proposing them, individuals wouldn't be able to have the access to the full amount of their tuition in many programs. So we're going to see people decide not to go be nurse practitioner. So we're going to see people decide not to go on to be nurse faculty. And this is going to exacerbate a shortage of primary care providers, as well as people who are teaching the next generations of nurses.
Yeah, and you mentioned just of the funding as people going to school for this, because it is an intensive process. And if you're a patient, you almost want it to be to get the best care necessary for this. Are you concerned about the perception as well? Because I know there's a lot of nurses out there that are already nurses, potentially going back to school. Just the perception from patients that they're potentially labeling nursing not as a professional degree. Do you think that hurts the profession?
No, I think we definitely need to clarify, and I think we need to make sure we speak very loud and clearly that nursing is a profession, nurses are professional, and that we're not going to, tolerate anything less than this. And it's absolutely important to be included in that Department of Education definition, particularly when they've added to that definition that they're looking at graduate versus professional loans, and that the professional loans are those high return on investment. And what is more possibly higher return on investment than nursing and advanced practice registered nurses, such as nurse practitioners and faculty? We are short primary care providers in our rural areas. We are short nurses. We're going to have at least 6% shortage in nursing. Now, we have over 5 million nurses, so 6% is a large amount. And we have tens of thousands of nurses retiring each year. We had over 80,000 applicants into nursing programs that were qualified that didn't get into their program, mostly because of a lack of nurse faculty. So we cannot allow this to stand, because it's going to have devastating impacts to the nursing profession and to the healthcare structure of the United States. Nursing is the backbone of the healthcare system in the United States.
And can you talk a little bit about the timeline if people out there are not nurses or don't know what it takes to become a nurse? Because obviously there are different ways, different institutions you can go through, but there's a lot of nurses that are already nurses that are going to get more letters to their name, obviously similar to what you have behind your name. Can you talk about that, how nurses become into this profession and how they continue their careers through that education process, even while working in the workforce?
Absolutely. I personally got my PhD in nursing so that I could teach over 20 years ago. And that was 5 years of graduate level education after my bachelor's degree. And that I acquired $100,000 in school loans. That was 20 years ago, and education has continued to get higher. So for those who are advanced practice registered nurses, these are nurse practitioners, CRNAs, your nurse anesthetists, your certified nurse midwives, and CNSs. These are individuals who need master's and doctoral degrees to be able to sit for their certifying exams to be those advanced roles. I would even add then you have the nurse faculty who need doctoral degrees in many instances to teach nursing. Also, I think is lesser known, but there is about 10,000 nursing students right now in what's considered master's entry nursing programs, graduate nursing programs, but that gets them in to be registered nurses. These are people who got maybe a first bachelor's degree in IT or communications, finance who decided they want to do something different with their life and want to feel like they're fulfilled. And they chose to go to nursing school. And so they're in an entry level graduate program to be an RN. And we're hearing from those individuals who are scared about potential funding issues with those programs. So we have many entry points for people who want to go into nursing and advanced nursing, and we do not need to limit any of those at this time.
And you mentioned an interesting part of this, and you mentioned kind of the return on investment for some of these loans, but maybe not necessarily about this, but the back end, because if people are nurses and they want to get another degree, it doesn't really work out financially for them, especially with potentially wages. Is there something on the back end, the hospitals or the government can do about that to make not only the schooling important, but the wages on the back end to pay back some of those loans?
Absolutely. Of course, we'd always encourage additional scholarships. There are programs like the Precept Act at a federal level that would encourage nurses to be preceptors for a tax credit. But really, what happens is when we limit federal loans, those who are trying to go into underserved areas, such as our rural communities, and get, for instance, public service loan forgiveness or loan forgiveness because they're working in a rural community, would only be eligible for those federal loans. If they did get private loans to help pay for their education, those private loans don't count towards those loan forgiveness programs. So the system is working for nursing, and I would encourage the Department of Education to, to include nursing in that definition before the public comment period. And that public comment period is sometime between December and January. We're not 100% sure, but let's change that definition before we go in there. I'd also encourage everyone to go to rnaction.org and sign our petition. And we have over 130,000 signatures already. And you don't need to be a nurse to sign that petition. It's really important for people to hear how important this is for really the safety and the health of this country.
Yeah, that is going to be my last question about what people can do, because you said this is still not necessarily officially permanent. Can you kind of reiterate that one more time about this potentially changing?
Yep, absolutely. So we're hoping that the Department of Education just doesn't, maybe just accidentally excluded nursing from this list, because the Trump administration has been very supportive of advanced practice registered nurses in this country. So we're hoping before the rule goes out to public comment that the Department of Education actually will update it to include nursing, graduate level nursing, advanced practice registered nurses in this. Now, once it goes to comment period, between December and January, we have 30 days to give comments. The Department of Education, one way or the other, is going to implement these July or the summer of 2026. So we've got some time, but I would continue to make sure we sign those petitions and let our voices be heard through rnaction.org to make sure we get this change in place.
Yeah, it's obviously nurses so vital to the kind of medical system ecosystem there that is obviously a very important point to make. All right, Dr. Jennifer Mensik Kennedy, I appreciate your time here on Live Now from Fox. Thanks you so much for joining us.
Thank you so much.